Hi, my name is Lauren. I'm a vet tech here at IndyVet Emergency and Specialty Hospital, and this is Reese, and we're going to show you how to give a feeding through an orogastric tube. So as you can see, Reese has a tube inserted into his nose, and that goes down into his stomach, and that allows us to provide nutrients to him while he's recovering from surgery. This is something that we do commonly after surgery, or if your pet has any sort of medical issue that's preventing them from getting enough nutrients just by eating normally. So I'm just going to go through the steps on how to check the tube and make sure that it's in place, how to prepare the food, and how to flush the tube at the end. So what I have here is Reese's food. Anytime we send a patient home with a nasogastric tube, we send instructions on how to mix the food, how much to flush, and basic care for the nasogastric tube. So I have this that I've already prepared. You do want to make sure that that's room temperature. You don't want it to be too hot or too cold. So a good thing to do is test it on the inside of your wrist and just make sure that it's a comfortable temperature. The other thing that I have is an empty syringe so that I can check the tube placement and also make sure that there's not fluid buildup in the tube or in his stomach. And I also have a flush to check the tube before I give the feeding and also to flush the food out of the tube after the feeding. So the first thing I'm going to do is I'm going to flip this tab open, and that opens the tube so that I can give medications or food through the tube. That does need to stay closed between feedings. So first I'm going to take my empty syringe and I'm going to attach that, and I'm going to pull back gently on the syringe. So you may get some fluid. Some patients will need to record the amount of fluid. That will be in your discharge instructions from your doctor. There's just a small amount of fluid coming from Reese's tube now, and when I let go of the plunger slides back up towards the top of the syringe, and that's how I know I have negative pressure in the tube. So now I know that it's safe to go ahead and start feeding. If I were to get a lot of air in this tube, or if I couldn't obtain negative pressure, you should not continue with your feeding. You should call IndyVet right away and get more information about the tube. Now that I've gotten negative pressure, I'm going to flush 5 mL of water through the tube slowly. This is just to make sure that there's nothing left over from the last feeding in the tube. And I also want to watch Reese while I'm doing this and make sure he doesn't cough or become uncomfortable, because that could indicate that the tube is not properly placed. So I was able to easily flush that 5 mL, so now I know I can move forward with my feeding. I can just attach that syringe and attach the food. And you do want to give this slowly. Usually we do a feeding over 15 or 20 minutes, depending on the amount of food that we're giving. And again, you just want to watch your pet during the feeding and make sure they don't become uncomfortable. If they're like licking their lips or burping a lot, you may be giving it a little bit too fast. If they start to cough, that's another indication that the tube may not be in place. The tube can be very irritating to their nose, so it may cause them to sneeze and kind of have some upper airway irritation like you just saw with Reese. If you ever get concerned during your feeding, you can always detach the food and you can try to aspirate with your empty syringe again. You may get a lot of food, but it is a good way to check and make sure you're still able to obtain that negative pressure that I showed you before. Once I finish the feeding, I'm just going to detach my syringe, and I'm going to use 5 more mL again to flush, and that just gets all the food out of the tube and make sure that it's clean and it's not getting clogged between feedings. So I'll just slowly push that 5 mL. Once I'm done, I can detach the syringe and just close the tube with that little plug there. And then typically we will try to have a piece of tape on the e-collar so that this is securely attached, so that when your pet's walking around, they're not able to step on this or get tripped up on their tube, and also so they're not able to chew on it. So this will just be affixed to his tube between feedings. I do suggest when you start a feeding that you make sure that your pet's comfortable. If you're able to have them sit on your lap or sit in their bed, just because the feeding does take about 20 to 30 minutes, and it's important that you and your pet are able to be comfortable and take that slowly so you can pay attention and focus on their reaction to the feeding and adjust as needed.